What are the possible consequences or complications of a high lymphocyte count?
Hello, everyone. Today, we're going to delve into a vital topic related to our immune system, lymphocytes. Specifically, we'll talk about what it means when you have a high lymphocyte count and the potential consequences or complications that may arise from it.
What are lymphocytes?
To start with, lymphocytes are a type of white blood cell that plays a critical role in our immune system. They are responsible for fighting off infections and diseases. Normally, they make up about 20% to 40% of all white blood cells in our body. However, if you have more than 40% lymphocytes, you have a condition known as lymphocytosis, which simply means a high lymphocyte count.
What causes a high lymphocyte count?
Various factors can lead to a high lymphocyte count. These include infections, autoimmune diseases, and certain types of cancer. Viral infections are the most common cause, with the body producing more lymphocytes to fight off the virus. Autoimmune diseases like rheumatoid arthritis or lupus can also cause lymphocytosis as the immune system mistakenly attacks healthy cells. Lastly, certain types of cancer, such as lymphoma or chronic lymphocytic leukemia, can cause a high lymphocyte count.
What are the consequences of a high lymphocyte count?
A high lymphocyte count may lead to several complications. For instance, if it is caused by an infection, it signifies that your body is under attack and is trying to defend itself, which can lead to symptoms like fever, fatigue, and swollen lymph nodes. In the case of autoimmune diseases, a high lymphocyte count may lead to damage to healthy tissues and organs, as these cells mistakenly attack the body's own cells. This can result in various complications depending on the organs affected. When caused by cancers like lymphoma or chronic lymphocytic leukemia, a high lymphocyte count can lead to serious health problems, including anemia, infections, and a higher risk of other cancers. This is because the cancerous lymphocytes are not as effective as healthy ones at fighting off infections and can also crowd out other healthy cells in the bone marrow.
How is a high lymphocyte count managed?
Treatment for a high lymphocyte count typically involves addressing the underlying cause. This could include antibiotics for infections, immunosuppressive drugs for autoimmune diseases, and chemotherapy or other cancer treatments for lymphoma or leukemia. Remember, if you suspect you have a high lymphocyte count, it's essential to consult a healthcare professional who can order appropriate tests and guide you in managing the condition. And that wraps up our discussion about high lymphocyte counts. Hopefully, this video has shed some light on what lymphocytes are, why they might increase in number, and the possible complications of a high lymphocyte count. If you have any further questions, please feel free to reach out to your healthcare provider. Stay healthy, everyone.